I would call City of Franklin Board of Health meeting to order, April 8th, 2024. At this time, Dr. Lavich and Debbie Davis are not here. Alderman Barber, I heard, is on his way, and Pat Golden, our health advisor, is excused. So first thing we're going to need is approval of the minutes from January.
I move that we approve.
Second.
Okay, any discussion? Hearing none, all in favor of approval of the minutes from January 8th? Say aye.
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 Okay, opposed? So those have been approved. There are no citizen comments. I do not consider them to be a citizen, so. Just before we get into anything, is there a time where you want the floor, or just?
No.
Okay. Okay, maybe we'll do introductions right away.
Wonderful.
Okay.
Do you want to introduce yourself?
I'm Lindsay Fisher. I'm the community health receptee here in Franklin.
Lindsay's been working with us since January on our health internship, so we know each other.
Where did you do your schooling?
UW La Crosse.
Oh, okay.
Yeah.
My daughter did that.
Amy Marzovka, board member, have been for about 3 years. Backgrounds in public health. Work now for Ascension, so more on the healthcare side.
And I'm Pat Nissen. I've been on the board a long time.
Too long. Yeah.
That's okay.
You and
So,
I.
I was on the board when I worked for Aurora Healthcare years ago. Now I'm retired, so I don't know what my role is, maybe retired person. But glad to be here.
Wayne Husted, I've been on the board 5 or 6 years. I'm a retired pharmacist. You know what else?
And I'm Henry Winchellowski. I'm a retired general dentist. And Pat and I, we've been on the board over 25 years, I believe.
Come on.
Yeah. So, okay. We will continue on then. Any unfinished business?
There's no unfinished business.
Okay, so we'll move right into new business, administrative updates. Franklin
All right.
Health Department Annual Report.
Yes, I'll start with a general update that we just closed out National Public Health Week. And so that was fun to celebrate with the department and in the community. So we were able to highlight the different services that our department offers on a small scale and just offer a highlight of service every single day. So we focused on car seats, Narcan training, environmental health, food and safety, and invited people to come into our department, although they can experience those services also Monday through Friday, 8 to 4:30 p.m. But taking the opportunity now to highlight the draft format of the 2023 annual report. So I'll point out the 3 things that are the reason that it's still in draft format, mostly because I would like your eyes on it before we finalize it. But one of the things before we jump into the report is I do highlight the Board of Health members. And in the past, we have put some titles on for individuals. So, for instance, if I have my Master's of Public Health, I may put my MPH. And I just wanted to bring it to your attention that we have your names listed. So I'd love to know your preferred titling or how you'd like your name to read. But I'll have you write that before the end of the day, just on my copy here. And then,
Picture.
yeah.
Agreed.
And then the page numbers will also be updated, and then any other things that you guys see that you'd like highlighted differently or changed. But this will be going to the Common Council and asked to be put on file at the next April, I believe, 16th meeting. So it's the second Tuesday of the month, second council meeting of the month, first
Is that
and
next
third.
Tuesday?
Yes. Yeah.
Yeah, the 9th is tomorrow, so.
Yes, it is. So at that meeting, I'll give them the same report, but then also do a couple slides on a slide deck just to give a highlight, because this is kind of a lot to digest in a 1 minute setting. But to give you guys the highlights of 2023, you likely are generally aware of almost everything that we did with our department. But one of the things that we did was to really grind down on the foundational areas of public health work. So those are communicable disease control, environmental public health, maternal, child, and family health, chronic disease and injury prevention, and access to and linkage to care. So those are the main categories that we're breaking down this report to read under. And then how we do that. So we offer different direct services to the community, all based on our community health assessment statute, and then guidance by what our local community needs are. Community engagement, so this is partnerships and relationships that we have across the community with volunteers, organizations, different sectors, all making for a healthier Franklin, and then looking at data, trends, health behavior, getting feedback from the community so we can really shape it to Franklin needs. Something that's really neat after we tallied it up is we had over 10,500 direct contacts. So those are either direct services that we provided or like direct conversations, so that we were able to count a point of contact. So that doesn't even include indirect through like messaging campaigns or billboards that we put out, and I thought that was pretty neat to have like a third of the population.
Is that more or less than the year before?
Good question, but I'm gonna guess more because we really try to ramp it up every single year of what we can do and what our outreach is, and something that really helps that is our volunteers. So we have about 300 volunteers on our Weaver list, which is that list that people can register through that Wisconsin registration system as a non-medical or medical volunteer, that they're pre-vetted so that if we have a local emergency, we can do a call down to them. But we also have a robust list of like lay people, volunteers that don't go through the intense background check that we can call upon as well. But that also includes the Franklin Health Collaborative, so that Franklin Health Partner Network that was created in 2023 as a highlight, and then Volition Franklin as well. In 2023, our department did over 1,000 communicable disease follow-ups, so that was with STIs, respiratory illnesses, and the different things broken down on the pie chart there. We offer TB skin tests here in our department, which we had 35 individuals come in for that, which broken down amongst the year is a couple a month, which is exciting. We were selected to pilot COVID-19 at-home tests when it was rolling out across the nation for local health departments to be a distribution site, and we had 106 come in 2023 for that. We do rabies follow-up, so if there's an animal bite, whether that's a dog or a wild animal, we ensure that there's not a spread of rabies through that, and that's often in coordination with the Franklin Police Department. Radon test kits, because a lot of people don't know that radon can be creeping into your house. We distributed about 80, and we did inspections through our DATCAP licensed inspectors, so that includes those typical restaurant inspections you think of, mobile, transient units, but also public pools and hot tubs. And that's broken down on the environmental health page on the bar chart. We also offer car seat fittings. So this is individuals who are looking to ensure that their car seat is properly installed in their vehicle. So oftentimes that's before the child is born, but sometimes we'll have people that already are using it or like made the transition to the next seat up and want to ensure they have a proper fit. And we're actually doing a safety day with that in the next coming weeks, so I'll have to remember to show you guys that to save the date. And we hosted over 20 events that involve maternal, child, and family health, so community-wide events with education included. We collected over 820 pounds of sharps. So we are a sharps collection site that people who are diabetic or have the need to get rid of used needles inside their home can come and drop that off. And we also host Volition Franklin within our health department. So that's the Substance Misuse Coalition that works to prevent substance misuse, but also does a lot of harm reduction now. So focusing on Narcan and ways that we can do that tertiary prevention. Something exciting is we were a Department of Health Services award recipient for our successful substance misuse efforts locally, so that was neat. We were invited to Washington, D.C. to present on that, and we also have worked with the library and presented at a library conference about how the health department and library partnered for health change locally. We do a lot of medication safety and disposal work with the police department and coordinate on that med drop box that's at the PD lobby so people can drop off their unused medications. And then that access and linkage to care, some of the highlights is we gave over 600 immunizations in the year of 2023. We handled 35 social service referrals. So the top need for referral was people that are aging in place in their homes. So if there's some kind of barrier there to people living like a fulfilling life or struggling within their home, mental health concerns, medical concerns, and falls. So falls is our top one. But then we also wanted to take a moment within our report to highlight the many, many volunteers we have with the Franklin Health Department. So that's really a joy that both supports our effort, but then also nice because they're an immediate informant of our efforts too. They can say what they're noticing that's working really well or help reach their neighborhood or their sector of the community that we may not otherwise have had a touch point with. And then on the mirroring page is some additional noteworthy accomplishments. So it was a record year for our trunk or treat event. So we had over
Even in the
1,200 people.
Yeah.
Yeah, even in the pouring rain. We collected over 1,300 pounds of food through our City of Franklin food drive that we coordinated. And then some other cool things is one of our staff members presented at a case study for TB at the TB Summit. And then just some other awards highlighted there. And then on the last two pages, which likely will be embedded after chronic disease, but right now they're just living at the end, is a highlight of Volition Franklin, because although it's a program within our health department, it is extremely robust, including all the sectors from the Franklin community, and it's brought in over $1 million to our city for substance misuse efforts, so worth calling out. So that is Volition Franklin at a glance, and some of the amazing data points about their efforts. So since Volition Franklin began formally in 2010, there was a 9.7% reduction in past 30-day use of alcohol among our youth. So that is youth saying that they consumed alcohol in the past 30 days.
How is that gathered? Is it a survey?
It's through the Youth Risk Behavior Survey.
Perfect.
Increase in perception of parental disapproval. So that's the number of kids who would think that their parents would say it was wrong or not okay to be drinking alcohol underage. Reduction in binge drinking in the past 30 days by 5%, and 15% reduction in students saying they've had at least one drink in their lifetime. So things are working. Collaborations are really incredibly strong. We're able to infuse ourselves across the community, and really exciting that now we have that community health network group meeting. So as I'm sure you know from our past meetings, like it's evolved from our general survey, our focus groups, our informant interviews, and now here we are hitting the ground running with our actual CHIP group. So we have about 30 people or 30 organizations that come to that. And now we're doing a rotating meeting all around the city of Franklin. So we had our meetings before at the library, and now we're going to Ascension. And then the idea is that members of that group will then host, and we'll do a little traveling show so that we're able to see different areas of the neighborhoods that we might not see, get to see new places, and then work on the main priorities of physical activity, nutrition, mental health, and then that community connection. So more to come in 2024, but this is a summary and a brief 20 pages of what 2023 entailed. So I would love to answer any questions, or if there's anything else that you'd be curious to know, and we can see if and make sure it makes it into the report.
The radon kits that are distributed, is there then a fee when they send it in?
Yeah, so then
Okay.
the individual that does the radon testing would do the postage and then send it
Got
for the
it.
free test.
Okay.
Any other questions? That sounds fantastic.
Then I would ask that you guys recommend it forward to the Common Council for presentation and to be placed on file with council.
All in favor?
Aye.
Anyone opposed?
You need a motion.
We
I don't
have,
think we, I don't,
I don't know if we have in the past or not.
on that, I don't think we would need
that's
a
Okay.
motion.
much, yeah.
I think
Great.
it's just a verbal, yeah, it's unanimous.
Sounds wonderful. Okay,
Okay, so that would be the annual report, and then there's the student preceptorships.
yes, so I'm talking to you all about the student preceptorships to come. So we have a couple students on the horizon that I wanted to bring to your attention because it's increased assistance for efforts that either we're as a board feeling are really critical to Franklin or to enhance our current efforts. So one of our interns is another UW lacrosse student. So a student that's one semester behind Lindsay, and her name is Laura. So she'll be doing 560 hours with our department from late May to early August. Right now, the tentative plan is to have her create really help to facilitate a youth summit about civic health. So how being engaged in your community and know the civic process can really then pay dividends in supporting health of your local community. And then she'll also assist with some of our emergency preparedness efforts. So we have a large event with the RNC coming up, and it's a really awesome opportunity for students to learn that piece of public health because I think that often goes unnoticed. And now she'll have exposure to that in helping with either doing some family assistance center planning or some warming, cooling shelter planning. Then we have another student likely on the horizon, so we're still figuring out their agreement, but mid-May to mid-June, so that's a lesser internship of 150 hours, and that's a master's student from the University of Nevada, and they would be assisting with reaching our immunization goal. So every year with our immunization program within the health department, we have certain benchmarks that we're looking to meet, and so she'll do a literature review of how to increase immunization rates locally, and then come to her own presentation of ideas of ways that we can increase our rates here for our youth benchmarks. And then last but not least, we have our AHEC intern. So that individual will be with us June 3rd to July 26th. So that will be 36 hours of work a week. And they will be working on our fall prevention. So with the absence of having a social worker with our department, we're trying to look in true preventionist fashion of how we can really get this fall information out to individuals so we're not having 5, 6, 7 falls happening, and we can hopefully skirt that after the first instance. So they'll be creating a comprehensive fall handout, so short, sweet, something ideally that EMS would have with them and then can leave at that individual's house. But we've also been doing some research on another community who did mugs for rugs, and the idea was that you would bring in a scatter, a throw rug, and then you would cash it in essentially, or turn it in for a mug, which then you partner with a local coffee shop or some kind of incentive so that individuals were getting rid of tripping hazards in their home. So the students project, that is the students project, so we will see what they come forward with ideas for. And then they'll also likely be doing the education at the summer concert series. So every summer the health department supports that series at Lions Legend with educational booths and tables, so that'll be one of the things that intern's doing. So since we'll have a lot of new faces coming in and out of the department in the form of internships over the next few months, I just wanted to make sure that you guys all knew that in case we didn't meet again before then.
Just out of curiosity, does Franklin reach out to the schools to accept internships? Do other health departments?
Other health departments do. We have definitely been a supportive pipeline for interns, so I very much welcome the idea of having interns. It is a bit of a lift on the front end, but when you have a constant conversation going in your department about ways that they can be advantageous, I think it's tenfold benefit. But yes, we have reached out in the past to get the relationship going.
And is there a lot of paperwork for you to do?
There is not. So I would say the heaviest lift is that pre-start, what are you going to work on and how are we going to make sure this is enriching for everyone involved? Because then the day-to-day handles itself. When you have a work plan going and know exactly what goals you want from it. The main paperwork is the MOU at the very beginning, so then that's vetted through legal, and then we take it to council for approval. And then from there, it varies.
What about with the school? So paperwork or communications with the instructors that are at the school?
Yeah, every program does it a little differently from what I've seen, because we've had nursing students, public health students at the master's and bachelor's level. We've had a MD from MCW, so it really all varies. And a lot of, and you can speak to this too, likely, but a lot of it is on the student end. So the professor is doing the checks and balances with the student on that end, and then they're doing more or less like an eval with us. Like, are you seeing what you need to be seeing? Are their skills getting strengthened and whatnot? And some schools are a little less on that, and some are a little more heavy. Like a couple have more intermittent check-ins, but for the most part, the student handles that all.
Yeah, I have more like written check-ins, and I had one like virtual check-in with my two main preceptors, like Ellen and Megan. So, but mainly it's just me kind of reporting back of what I'm doing and what I'm learning.
And what do you have to do then at lacrosse?
At the very end, I have to give kind of like a health expo style, kind of what I did and what I learned, and I have to go back to lacrosse to do that.
Okay. Great. Are there any other questions? If not, we'll move into clinical service updates.
All right, so I will pass this around as well. So this, just twofold of reporting. This won't be the case all the time, but only because the annual report's also on the horizon. But this is the quarterly report for the Board of Health. So it summarizes the direct services and clinical services of quarter one for 2024. So it's a little bit mixed in both with the summary of events that we had this quarter and also direct services. But you'll see on the second page, communicable disease and like extra save the dates. And on the first page, you'll see more or less of that report. So in the first quarters of 2024, we've been seeing a steady decrease in communicable diseases from January to March, which is to be expected because of the decrease in respiratory illnesses. So with RSV and COVID-19, like on their seasonal drop down, that's why that stuff is happening. So nothing new there. Some new updates within our department is around the meninge vaccine. So the FDA has approved the 2 vaccine down to 1. So that's something new for us. And then we are now also approved to do the RSV vaccine through Vaccines for Adult program. So that's the program we work through the state of Wisconsin. So we'll be able to offer that within our health department. And then something that we felt necessary to note is just to highlight how measles has been in the news a lot lately, just for situational awareness. So it is a contagious disease, but it also is preventable with a high effectiveness with the dose of the vaccine, which we also offer here. So individuals can get that at their local health department, at least here in Franklin, if so inclined. And I'll kind of save the rest of this for the next agenda items as we go down.
Okay, so then communicable disease report.
I kind of crossed over. There's really no clean way to do this because I don't want to keep information, but I also do have the communicable disease actual report that we compile. So this internal for the Board of Health report highlights the different communicable diseases that we saw in this quarter, and then just as a reminder, in the far right column, we do a compared to Milwaukee for the same time period. So you'll see quarter one highlighted in the far left column, and that's for the Franklin Health Department, and then Milwaukee County on the far right. Realizing that obviously the county is much larger than our city, that was the point of reference, so that we were kind of looking to go off so that we just have a general idea of where we are. And then under 5 is suppressed for confidentiality.
Just out of curiosity, it doesn't have anything for 2023.
I can put those in there. So do you want
Why do you
the
want to make a
total?
comparison?
Okay, yeah. Sounds good. I'll update them.
I see where it says it's less than 5, but that's just the number.
Sounds good.
Okay, are we done with clinical services one? Then we'll go into health department program updates and community initiatives.
All right, so on that same quarterly report, I highlighted some of the fun things that happened at the beginning of 2024. So one of the most notable things is that we did receive our Narcan from the state through that grant program that we wrote for, and we are able to start providing Narcan kits free of charge. So staff received training and are now trained on both teaching how to administer, and then also we have the supply to be able to give community members that. So people can come to the health department during regular business hours, and we can do a just-in-time training, like right at the counter, just over here. We also are shaping our plan for community trainings. So if someone calls, we'll be able to offer that. But right now, we're just trying to figure out how to package that so that people can sign up in an easy format. We completed our hearing and vision screens at the public school, elementary schools for kindergarten, second, and fourth graders. So we had over 800 students screened, and the Lions Club was nice to assist with that. So they did a lot of the heavy lifting of getting kids through the lines and making sure that everything was running smoothly. So thank you to them. We had Light and Unite Red Week, so we had the mayoral proclamation for Light and Unite Red, and then city departments and city community organizations in Franklin supported through wearing red and a lot of other substance misuse prevention activities. Something new that we're trying is we're piloting a daycare education program. So one of the things that we're looking to do with that community health network group that the health department has running is increase community connectedness. And we're trying to do that through socialization and daycare. So it's an uphill battle, but some of the children who were born within COVID years or are in elementary school during those times, we're trying to increase ways that you can collaborate in your classroom, in your community, and we're taking that through the lens of health priorities. So public health staff have been piloting that at Jubilee.
How many daycare are there in Franklin?
Oh, good question.
8.
Okay, I was going to say
8.
11, 8.
Does that
Amy's
include,
called them all.
Oh, yeah.
does that include K3 and K4 programs at schools or
That doesn't include the med schools. These are just,
private daycare?
Yeah.
Okay.
All right, we are doing Stand Up for Health. It's a program for older adults, so promoting physical activity. We kicked off the food drive. Very cool. I believe we're in our 27th year of the tobacco poster contest, and we've created relationships with administration at Indian Community Schools. So now we're offering it there as well. So we just closed the poster competition for that, and now it's going out to the judges this week, and we'll be picking the winners with the panel for that. We have staff trained in youth mental health first aid, and they were able to partner with the Franklin School District to offer a training within the school district. We're really ramping up emergency preparedness efforts. So health department and Franklin Fire Department staff went to the governor's conference, so that's on emergency management and training as a joint effort. And then our first health partner network of 2024 happened in January. And the next one is to come on, I want to say, next Thursday? I think next, okay, I'll have to give you guys the date. But I will definitely send it to the Board of Health because it would be lovely to have a Board of Health member there. So if we can prearrange someone who's interested, that would be wonderful. Debbie has attended one or two in the past, but a rotating attendee or someone who's passionate about it would be great. So I will send that email to you guys. Okay, and then I'm just quickly checking to make sure I'm going in order here. But then we go into the direct services as well, and I thought it would just be interesting to highlight. So we've done 360 total direct services so far in quarter one. And you can see the breakdown there.
in regards to a water test kit, is that something that you provide and then they send in?
So
Okay.
similar concept to Radon.
Radon. So someone thinks maybe their water isn't.
And they could also go to the inspection department as well.
Okay.
But it's something that we offer as a counter service. Yeah, and then you can do
Okay, you
water
just
testing.
hand out the kits.
Mhm.
Okay. Just curious.
Okay, now, did you include the emergency preparedness with that? Or do you have other items for that?
I did not. I do have other items for that, but I almost missed a really great part of our report, and that is the thank you to Lindsay. So Lindsay has been really hard at work focusing on different health initiatives here, one of them being the Narcan training toolkit, and then we're also working kind of behind the scenes on a park passport that we're hoping to present to the Parks Commission in the very near future and DPW to get some feedback. But the idea has come from that community health partner network, and the premise is to get people out and moving. So how do we utilize our Franklin parks? How do we really get out there? Because on our community health assessment, a lot of people said they appreciated the parks, but a lot of people did not say they went to the parks. So how do we bridge that disconnect? And then we wanted to go to Parks Commission with more than just a concept. So Lindsay's like working it a little bit more to get like a laid out plan to ensure that they like it, DPW thinks it's practical, and get all different kinds of lenses of feedback. So thank you, Lindsay. And then also Hayden, she's not here and she's not pictured, so sorry to Hayden. We did not get her picture, but she is doing her preceptorship here for her master's right now. And she's doing a lot of work with our environmental health program. So she's creating like a very short, abbreviated program brief, because that program is like incredibly in depth, and just the public is not very public facing. Like a lot of general community members don't know what all goes into that program. So Hayden's focusing a lot of her efforts on that. And we're also doing our park audits, which is going somewhat hand in hand with the park passport. But this part of the project is looking at the different parks in Franklin and having individuals from the community, like older adults, younger adults, middle age, everyone, take these audits and assess different criteria of accessibility. So we have a predetermined audit tool, and everyone's doing the same one, and it's like high visibility, is there a curb, are there garbage cans, like it's a bunch of different access questions, and then we're going to summarize those results and again take it to parks and say, what can we do now? We have this community health group working on different efforts. What can we collaboratively do to make parks better for all? And then save the dates.
With the park passports, are there perks or incentives to having the passport?
If you want to talk about it a little bit.
Yes, so kind of the focus of the Parks Passport's like more kid-centered too, so going to like any parks and playgrounds. So we found like there's like probably 10 playgrounds in Franklin.
Kilos is
Yeah, that are kid-friendly. So I think we said around like 7 out of 10 if you go to those and answer like a specific question from that park to kind of prove you were there and that you did something there. We get like a prize. I don't know. We don't know what kind of prizes yet, but kind of like a smaller prize if you turn it in at a certain time.
And Lindsay has pre-identified the questions,
Okay.
so you might go to Lion Legends and it'll be like, what color are the slides? And then you're going to Kayla's and saying, are there wood chips, or is it a like special exploring? Things like that, so that it's not meant to be a deterrent, but more a motivator to be able to get out to the
some
parks.
kind of incentive.
Yeah.
Yeah, so the group will be taking those things forward to parks,
Okay.
likely at their next meeting. Thank you for sharing. And then those save the dates. So the safety day is mentioned. It's this Saturday from 12 to 2 at Fire Station 1. And that is in partnership with State Farm, the fire department, and police. So we're going to offer a medication collection, mostly because one of the ways to prevent misuse of medication is to get it off your shelves. And we find a lot of people hoard their medication until our fall wellness fair. So this is a quick drive-through, easy way to get your medications out of your house. And PD will be set up there with us. Our trained car seat technicians will be there so that we can do those car seat checks. And then we're also going to have information like fire safety and just generalized pedestrian safety. The Lions Club is partnering with PD and distributing, I think they are calling it Safe Strider vests, like high-vis vests for people to wear when they're walking around Franklin. And the health department's one of the pickup sites, so they'll also have those vests available for free there.
But it'll also be at the safety day?
Yeah,
Very
from
cool.
12 to 2. And then our bike rodeo in June.
And just out of curiosity, what has Franklin done for the RNC preparedness?
great lead into emergency preparedness. So RNC is on the horizon. So we have been focusing on this for probably at least a year now about different ways that we might be called upon or need to respond. From a public health perspective, it's a lot of different things, but one of the main things is that we have open points of dispensing. So if there was some kind of terror attack or some kind of mass illness that we had to either distribute medication in pill format or a mass vaccine clinic, we would be able to do it at our open point of dispensing, which right now is at Forest Park Middle School. So we've been putting a lot of work into ensuring that those plans are well laid. And then for every open pod of dispensing, the idea is that you're throughputing your entire population through there to get the medication, if needed, in a certain amount of time. But we also look to set up closed points of dispensing so that they're smaller offshoots. So for instance, if you have a huge company here with 500 employees, you could look to do a closed point of dispensing so that it's more self-managed and those people aren't going to the main location. So that's been a lot of it. A lot of the other pieces have been around thinking about food safety, because if you're having delegates stay in your jurisdiction, that'll be of a concern. And then after big events, often come a wave of STIs. So that is also on the horizon for us. But right now, it's just making sure our volunteer list is robust, making sure our community members are signing up for the emergency notifications within our city if needed, but hoping that these are all unnecessary precautions and you plan for the worst and hope for the best. And that is what we'll be doing.
Are they expecting every hotel and motel to be filled?
They are very, very far reaching. So it'll be a very busy week in the Milwaukee County and surrounding area.
Great.
But stay tuned. But more to come on that. And we encourage people to both sign up as Franklin Health Department volunteers, but also as to get notifications, emergency notifications. So they can sign up right on the city website. All right. And then the last thing is environmental health.
Go ahead.
So that's all still wrapped up into the same report, but on the bottom you'll see that we have done 43 inspections thus far in 2024, and then a breakdown of the percentage. So 50% have been those routine inspections. So every year we aim to get into a restaurant 1 to 2 times for their annual inspection. Follow-up, pre-inspections, mobiles. So you'll expect the tide to turn as we get into the warmer months with more food trucks coming, more summer events, that mobile will increase. And you'll see a lot more of that in the near future. I wanted to give a snapshot of what Q1 was looking like.
Do we know what's now going on with sound at the Rock?
I, from a health department perspective, have no updates, but I do believe that it's being addressed regularly at council meetings as a standing agenda item.
Okay.
Is
Just-
anyone here from the council that would like to provide an update?
We will allow any information to this board.
I
That may be
I
useful.
can give an update if you'd like me to give an update.
Please do.
There's a committee of the whole meeting tomorrow night at 6:30 where the council will be discussing the Milwaukee County sound study that came out regarding the Rock, as well as any updates on the city side with processing those sound complaints and the events and whatnot that are coming now that we're at that time of the year for the Rock. So it will be on the YouTube channel. So if you go to YouTube and do City of Franklin, you'll be able to either watch it live or watch it back. But yes, so tomorrow we'll be discussing it in depth. No action will be taken because it's a committee of the whole meeting, but usually whatever gets discussed there, if there was something that we want to take action on, it would then appear on the next common council agenda.
Okay. Do you expect a big crowd?
Yes.
Okay.
Right. But that is all for our quarterly report. As you're looking at this in your spare time at home, talking to your friends about it, if there's anything that you would like to see different, I feel like we're almost to the exact report format we are all looking for, but happy to take suggestions. And the last page, you'll just see that service breakdown for the board.
Great. Are there any other questions? And we need a motion to adjourn.
So moved. Oh, sorry.
I make a motion to adjourn.
Okay, second?
Sure.
Okay, any discussion? Hearing none, all in favor of adjournment? Say aye.
Okay.